Good afternoon, everyone. We are going to get started. Welcome, everyone. I see you joining. My name is Latoya Harris. I am a program analyst in the Office of Women's Health at the Department of Veterans Affairs. We are so delighted to be hosting this virtual Veteran Town Hall in honor of American Heart Month. We have been collaborating with the American Heart Association since 2013 to bring educational opportunities to veterans and to staff related to cardiovascular disease. And today's panel discussion, it's hopefully going to share some of that education related to heart health and hopefully improve your awareness so you can then share that information with your family and friends as well. As you are logging in, please drop us a hello in the chat and tell us where you are joining from. There will be a time for question and answers at the end, so definitely stick around so you'll have the opportunity to provide any questions that you may have. Welcome. I see everyone signing in. It's so great to see everyone. All right, I'm going to allow Dr. Sally Haskell to bring greetings from the Office of Women's Health.
Hello, good afternoon, everyone. On behalf of the Office of Women's Health, where I'm the Deputy Chief Officer in the Office of Women's Health and VA Central Office, I really wanted to welcome you to the call. We're so excited to have this opportunity to celebrate Go Red and Heart Month with you by recognizing the importance of cardiovascular disease and the prevention of cardiovascular disease for women veterans and for all women. So thank you so much for joining, and I will turn it back to you, Dr. Harris.
Thank you, Dr. Haskell. And without further ado, I'd like to invite Heather Simpson to come on from the American Heart Association to also bring greetings.
Good afternoon. Thank you so much for joining us this evening. We really just wanted to talk about a little bit about Go Red and the fact that it's the American Heart Association's signature movement. This movement is dedicated to women's health, and when we launched in 2004, we really was because we found that women were not aware of cardiovascular disease as their number one killer. And Go Red for Women is a resource for women across the life course, meeting women, evolving in their needs at every age, stage, and season. So Go Red for Women is a trusted source for credible and equitable health solutions. And in the over 2 decades that we've been around, we've sought to increase awareness, address clinical care gaps, and fund life-saving research. There's still a lot of work to do. And that's why we're so proud of the time that we have with you all. This ongoing alliance with the Department of Veterans Affairs has been instrumental to us in reaching women veterans like you. So on behalf of the Go Red for Women team and our movement, thank you for joining us and taking the first step in improving your health and well-being. Thanks, Latoya.
Thank you, Heather. Okay, so today we are going to have a panel discussion, and I am joined by Lori Sepich, who is a heart attack survivor, Dr. Adende Shewo, who is a cardiologist, Dr. Mariana Avery, who is a clinical pharmacist, and Ann Sayers, who is a nurse care manager at the VA Portland Healthcare System. We are so excited to bring this to you guys, and I want to give a chance for Lori to share a little bit about her story.
First off, happy Heart Month to everybody, and thank you so much for the invite to share my story. My name is Lori Sepich. I live in Memphis, Tennessee, and my journey of heart disease would start at age 17 when I would be diagnosed with extreme hypertension in a pediatrics office. That day that happened, I really didn't understand what that meant, nor, and I hate to say this, nor did I care what it meant. I was 17, I was going to be a senior the next year, so that was my thinking, was just at the moment for where I was. It certainly wasn't thinking ahead to what this would mean for my heart health at all. I was born into a family with 100% genetics for heart disease. But again, like I said, I did not understand it at 17, nor did I care to understand it, unfortunately. I would spend the next 12 years maybe taking blood pressure medicine, but more so than anything, really ignoring it, not taking the medicine as directed. At 34 years old, I would go to the physician because I was running out of the medicine, which I don't even know why I went to get it filled, but something made me go. And he asked me that day, "Are you taking your medicine?" And I said, "Oh, yes, I take it every day." Well, he knew I was a liar and he called me a liar. And he said, your blood pressure right now is at a stroke level, and I legally cannot let you leave this office without bringing it down. So you can stay with me the afternoon in a room, or you can go next door to the ER and let them handle it. So I am very thankful that he did take me to my knees. I was a liar that day. I cried. I was upset at myself. And he really made me understand what high blood pressure means as far as having a stroke. And at 34, that was not what I needed to have. That also was the case at 17. My blood pressure was so high, I could not leave the pediatrics until it was brought down. I would come out, I would start taking a little bit better care of it. Absolutely. So, yay for that. Although there was cholesterol going the scenes that I was choosing to ignore and act like it didn't exist. So at 17, when I first heard the words high blood pressure, I instantly went into a state of denial about this heart disease. And probably a lot of it was the things I would hear that my parents were discussing about my older brother having it and different things. And I just knew that it wasn't good. And I just didn't want a part of this at all. Easter Sunday in 2005, I would wake up. I was 43 years old. I would experience pain radiating down both arms, extreme chest pressure, instant cold sweat, instant nausea. I knew that I was having a heart attack. I did nothing about it. I did not call 911 because it was Easter and I had a lot of responsibility that day. I had lunch, I had mass to go to, things with the family, and my mind just completely was like, if you can block this out, it's going to be okay. I laid across my bed and I absolutely prayed to God to keep me alive. And one of the reasons that I was so scared was my oldest brother died at 38 years old of a massive heart attack on Thanksgiving night. And my whole family, our world changed. And for me to be on Easter Sunday having the same thing, I absolutely panicked because I thought, oh my God, now it's me. The next day, the pain would continue. I would take myself to the ER. On the way to the ER, I would smoke one last cigarette because I had picked up smoking. So everything I was doing through denial was harming myself. I walked into the emergency room and I said, I think I'm having a heart attack. It was confirmed that I was. They smoked. I I quit. And they said, when did you quit? And I said, about 5 minutes ago when I walked in the store. So I did have a heart attack. I would have 6 stents placed. I would be in the hospital almost a week. I would come out and I would be in shock. I would be physically in shock, and more so than that was me just upside down. I reached out for help with my cardiologist, and he was very proactive in getting me help mentally to get me through this major event that had just rocked my world. I would go 13 years, and then at work, I had just started a new job and I would experience that same pain. And again, I did nothing about it at that moment. I did not call 911. My biggest fear was I was 6 weeks into a new job and I felt that if I told this, I would be fired. I did not know that for sure, but my mind went there. And part of that is denial. I would end up in the emergency room. I would end up having survived a widowmaker heart attack. I would get 3 more stents in the widowmaker, and I would come out with event number two. Again, shocked and having to work through a little bit of mental health issues to get back and know that, hey, I'm okay about this. 6 months later, the company I worked for asked me and they go red for women because they sponsored the AHA. I did not want to go to the luncheon because I wanted no part of it. I ended up having to go. I wore turquoise and in protest. And when I walked in the luncheon and saw a sea of red, it took my breath away, all the support that I saw. The first lady that I heard speak and share her survivor story, I realized that that was my story that I was hearing for the first time because I had spent so much time suffering in silence and denial. My ears were finally opened and I felt seen at that luncheon. I would speak with the AHA the next day, my local chapter, and we have been together ever since. And it's been an amazing experience. So to be asked to speak at this about knowing your numbers are very important. Had I taken it more serious, my numbers and that, then maybe I wouldn't have been in the situation that I ended up in. But regardless, I have survived it. I am proud that I have survived. I am proud to be able to speak to somebody else and help empower them through their journey that maybe they felt very alone in, like I did. But your blood pressure matters, your BMI matters, your cholesterol matters, your blood glucose matters. All these things affect heart health. So I can't stress enough to be aware of them. And I can't stress enough to, if you smoke, to stop smoking. That was the biggest blessing that came out of my first heart attack, is to come out as a non-smoker. But the small changes that you can make to your heart health every day, small changes add up to big results. So again, I think this is a wonderful topic that you're addressing because, like I said, I experienced the ignoring of them, and I experienced the result of that denial. And to be where I am today and to be a part of the National 2026 class of survivors is absolutely a blessing to me. And with that note, I'm going to end with my mission statement, and it's always to love your heart and to love yourself.
Thank you so much, Lori. That was truly inspirational and very scary. I know that was incredibly scary for you, but we thank you for being here and sharing that story. And we know beyond a shadow of a doubt that you are empowering others to be heart smart and take those numbers seriously. With that, I want to transition to the important discussion around knowing your numbers. And Dr. Ade Dinshewo, I wanted to bring you on and have you introduce yourself, let everyone know why your role here is so important. And then I'd like for us to really transition into understanding exactly what does blood pressure mean?
Thank you so much. So, as introduced, I'm Dr. Adedin Shewo, and I am a non-invasive cardiologist, which means that I don't do invasive procedures, but I'm a doctor that takes care of patients with heart disease. I also see patients who do not have heart disease, but may be at risk for having cardiovascular disease. So a lot of my work does involve discussing and counseling patients when it comes to their risk factors and how to prevent heart disease so that they don't have to see me on the long term. And if they do have heart disease, then I also like work with patients to make sure that we are limiting their risk of developing adverse outcomes or more complications or recurrent cardiac events. I also spend a good bit of my time on research. So, my research interest really focuses on heart disease and cardiovascular health among women, and also during pregnancy and the postpartum period. So, I'm happy to be here today to talk about this very important topic. So, I know, Latoya, you mentioned earlier that I should kind of segue into talking about what is high blood pressure and why does it matter. So, high blood pressure is considered, or sometimes called hypertension, and is considered one of the most important cardiovascular risk factors that we can actually do something about. Unfortunately, many people will develop hypertension or high blood pressure, may not have any symptoms, but this does not mean that high blood pressure does not put you at risk for heart disease. So, because you don't feel bad, even though your blood pressure is up, is why hypertension, we frequently refer to it as the silent killer. It actually comes with the risk of having heart attacks. I know that Lori just told her story, is also associated with the risk of getting or developing a stroke, heart failure, kidney disease, and multiple other complications. So, high blood pressure is something that is important for us to recognize as a very, very big risk factor for heart disease. And the good news is we can do something about it.
Thank you so much. I think you did a really good job of explaining that. I know one of the things that Lori highlighted in her story is that she was not aware. And I believe the latest statistics is that about 45% of women may be living with high blood pressure or heart disease and not be aware of it. What is your main takeaway for the audience in terms of how targeting high blood pressure? What do those numbers look like?
So I would say it is very important to have your blood pressure checked. Without checking, you don't know if your blood pressure is normal or not. So that's why the theme of this entire discussion today is going to be knowing your numbers. So often, if you have a doctor, your blood pressure will be checked in the office, but now we are also recommending that you kind of take charge of your own health. So you can get a blood pressure cuff at home. I know we will discuss in more detail as the conversation evolves, and measure it. So if you know what that number should be, then you know if you're at risk, and then you know how to have that conversation with your physician when next you're seeing them in clinic. So I think, Latoya, you asked what it counts. What is a normal blood pressure? So normal blood pressure, we define this as values, the top number, which is called the systolic blood pressure, less than 120. Then the bottom number, or the diastolic blood pressure, less than 80. And this is based on recommendations from the American Heart Association and the American College of Cardiology. And this is what we consider normal. Then we have kind of like ranges in between where we talk about it being elevated. And at what point do we start to call this hypertension? Is if that number, the top number, exceeds 130.
All right, great information. I want to bring in Anne because I know that she works with a lot of our veteran patients in our women's health clinic. And Anne, can you share with our attendees ways that they can help keep their blood pressure in check? What would be the tips that you would give them?
First, a good first step would be making sure you're established as the primary care provider at the VA. By doing so, you will have a whole team of resources to help you guide a healthier lifestyle, from a nutritionist. There's mental health providers that are on each individual primary care team. There's a nurse care manager. That's what I am. So I do a lot of the follow-up calls, checking in on blood pressure, seeing how you're doing, identifying barriers, and coming up with a plan, a collaborative plan. We also have a pharmacist that's is more readily available if you are started on medications, meets with you a little bit more frequently, can monitor for symptoms of, starting a blood pressure medication, and it's not a one size fits all. And that way you have closer follow up, and you're heard if we're prescribing a medication that impacts your life, and it just is very difficult for you to have, based on any symptoms. This pharmacist can actually prescribe you new medications and also check your lab values. We have nutritionists on every primary care panel. A lot of people don't realize that the whole team that's involved. So that's a good first step. But even if independently from separate from just primary care, there's a lot of self-referral classes that are available from the VA. There's a plethora. There's going to be some links at the end of the presentation, but anywhere from whole health, looking at yourself as a whole person. You're not just a diagnosis of hypertension. You are a whole person with lots of things to consider, and coming up with goals that are meaningful to you. Centering around your life and what your goals are, and in kind of managing and trying to get just in a successful number so you can have that higher quality of life. And we also have a lot of great weight management resources. So if you're trying to lose weight, even if you don't want maybe to try one of the medications right now, or you don't are fit in the parameters for the prescribed, there's a lot of other movement classes, and there's telemove a lot for our rural veterans that live kind of out of the huge VA hubs. We have programs like remote patient monitoring, and it's a home telehealth thing where, when you're just trying to get your hypertension under control, you have someone like an RN like me that will be calling and following you a little bit closer. We want to make sure this is accessible to everybody where they're at, meet them where they're at. First, in your nurse care manager, when you establish with a primary care provider, you'll probably have to tell them to stop giving you resources. Hopefully, that's my hope for you guys. I'm a veteran as well, so I get my care in the women's clinic, and so I get both sides of it. You can always tell us, okay, let me just work on this. You could stop offering resources, but we got a lot to support you, so I really encourage you reaching out.
All right, thank you, and some great tips there. And Dr. Adendeshewo mentioned self-monitoring at home. So I did want to take a few minutes for us to discuss with our audience the proper way to take that blood pressure at home. And as we transition and bring that slide up, I want to ask all of our attendees, if you are not too embarrassed to share, let us know the last time you had your blood pressure checked. And I will bring Dr. Adendeshewo back to the front to talk to us about properly measuring blood pressure at home.
Thank you so much, Latoya. So this is an excellent graphic, and I'm glad that you have it pulled up. So hopefully everyone can see it. It's very important for us to all know how to measure our own blood pressure at home. So as you can see in that graphic, there's a woman sitting on the chair. You can see that she doesn't have her legs crossed. The goal is for you to be comfortable, sit comfortably before getting your blood pressure checked. And also when you're ready to check it, you want to make sure that the arm that you place the cuff on is supported. You can see she has that arm on the table. There's a pillow supporting the arm, because if you don't have any support and you're lifting the arm up, that can impact your blood pressure number. So general rule is that you want to check the blood pressure after you've been in a resting state for a while. So, no caffeine, at least within 30 minutes prior to check-in or exercising. And then if you're seated, you want to wait for about 5 minutes if you can before you check your blood pressure. And all of that information is in the graphic. When you check it, we sometimes recommend that you have a repeated measurement, so a minimum of 2, and you can take this 1 minute apart and then use the average blood pressure. If this is the first time that you are doing this, so sometimes it's been discussed that the first day that you do it, because there's anxiety, you're still learning, figuring out how to do it, you can discard the first day's measurements, and then by the second day, you should have figured it out. So then you would track your blood pressure this way, and then be able to provide that log to your primary care physician or a clinician that you're seeing in clinic so that they can work with you on how to manage this. If it's controlled, great. If it's not, then they can come up with a plan, medications, lifestyle changes to help you control your blood pressure.
Excellent. Now, when we're talking about knowing your numbers, in addition to blood pressure, we know that cholesterol and glucose also play an important role. Can you discuss that with the audience as well?
So yes, there's something that the American Heart Association has developed to kind of help us get a very good understanding of all the important numbers for our health. And this framework is called Life's Essential Eight. So if you wanted to look it up later, I wanted to mention it early. It talks about things that you can do from a behavioral standpoint and things that need to be measured, which are the key numbers we're talking about today. So one of them is blood pressure. The second one is blood cholesterol, and the third one is blood sugar. All of these key things, if there's abnormalities with them, increases your risk for heart disease. So we've talked about blood pressure, blood cholesterol. If this numbers for your cholesterol is elevated, puts you at risk for heart disease, particularly things like heart attack or increased risk for what we call like plaque, which is basically this kind of soft, mushy tissue that gets deposited within the blood vessels around the body and increases your risk for not just a heart attack, but stroke or disease that affects the blood vessels in the lower extremities that causes a lot of pain and discomfort. So for cholesterol, the number that we usually like to talk about is something called non-HDL cholesterol. And I know it's a lot of information, but the simple way to think about it is HDL is considered your good cholesterol. So every other cholesterol that is not HDL is kind of lumped together in one, and that's what you want to be under control. So your non-HDL cholesterol, ideal goal is to have this under 130. And then for your blood sugar, this is kind of synonymous with the diagnosis that we refer to as diabetes when the blood sugar is uncontrolled. Also, a very big risk factor for heart disease. The way that your clinician will measure this is either through a fasting blood sugar or something called an HbA1c, which is a single blood test that gives us an idea what your blood sugar has been over the prior 3 months. And for your fasting blood sugar, the number you want is less than 100. And for the HbA1c, the number that you want for that is less than 5.7%. It's kind of how we measure it on a blood test. But even if you don't remember these numbers, most important thing is talking to your clinician about getting these things tested. And we can talk about how frequently you need to have it done as the conversation progresses.
I think that's a great opportunity to bring Dr. Avery into the conversation. Dr. Avery, when we talk about blood sugar and cholesterol, one of those we can also monitor at home, much the same way we do blood pressure. Can you talk to us a little bit about how you work with veterans and then tell us a little bit more about at home monitoring for blood sugar?
Yes, of course. Hello, everyone. It's a pleasure to talk to you today about some essential aspects of our health. My name is Mariana Avery. I am a PACT and Women's Health clinical pharmacist practitioner in the Reno VA. And over the past year, I have been collaborating with the Office of Women's Health to pilot a women's health cardiovascular dashboard. And first, I just wanted to say this. You're more than just a number, but understanding your numbers give you power. For those who are pre-diabetic or diabetic, we can self-monitor blood sugar, provides real-time information about your body response to food, activity, stress, and medications. Your healthcare provider will advise you on the frequency of monitoring based on your specific health needs. When you monitor your blood sugar, there's a couple things we want to make sure you focus on. Fasting in the morning, that number will tell us how your body manages blood sugar overnight. Blood sugar levels 1 to 2 hours after meals. This shows how different foods affect your blood sugar. And then we also want you to test anytime you have symptoms of low blood sugar. That would present as shakiness, sweating, and confusion. Keeping a log of those results. to track trends over time and bring those numbers to your follow-up visits so your healthcare provider can make informed decisions about your medication regimen. Remember, your glucose meter is a tool for information, not for judgment. Used to make informed decisions about your health. Look for patterns and not perfection.
I like that a lot. Patterns, not perfection. That's excellent.
And then you wanted to know how we discuss therapy with veterans. So as clinical pharmacists, we are committed to providing veterans with the best care and support, ensuring medication management is as seamless and effective as possible. We educated our veterans on how their medications work, their potential side effects, and the importance of consistent usage. Our comprehensive medication management is evidence-based and involved shared decision-making, including discussions of alternative medications when appropriate. We can help monitor the responses and side effects, and we integrate those results into patient care decisions. And then another thing I wanted to make sure to mention is a special consideration for women's veterans of childbearing age. Please inform your healthcare team if you're pregnant or planning to become pregnant, as some commonly prescribed medications for blood pressure, blood sugar, and cholesterol may need to be stopped or changed to avoid harm to your baby. Your healthcare team can then prescribe safer alternatives.
Thank you so much, Dr. Avery. Dr. Adedinshewo, how often should our veterans and participants tonight check these numbers? I see that we have quite a few that are very much on top of their blood pressure. Can you give us a little bit of guidance on that?
So yes, and the guidance I will provide, I would see this is considered generic or general guidance. Sometimes this guidance changes unique to you. So, we just talked briefly about if a patient has diabetes, there's specific guidance that your clinician might provide to you that changes monitoring. But in general, if you're healthy and you've not been diagnosed with high blood pressure, high cholesterol, or diabetes, then we recommend if you're going to see a doctor that you have your blood pressure checked at every single visit. If you're going to be monitoring at home and you haven't done this before, the general guidance is that you do this every day for at least a week. If you're going to discard the first day's numbers, then you need 8 days to make 7 days for us to see consistently what is your blood pressure doing. And we recommend in a day when you're just starting out, the general recommendation is about 4 times a day. So 2 early in the day, 2 in the evening. It's a little bit more intense when you get started, just so you get the hang of doing it and we have a better idea of what your average blood pressure is throughout the day. After the first week and we get a good sense of what your blood pressure number is, you can actually monitor it as little as once a week is actually considered sufficient. So just so you know, for home blood pressure monitoring. For your blood cholesterol, we recommend starting as early as age 20. I assume that many in the room or listening might be at least 20 and older. So if you haven't had your cholesterol checked, it's time for you to reach out to your clinician. Imagine if you're at the VA, you're getting this checked. So you start as early as age 20. And if the numbers are normal, then it can be spaced out approximately every 4 to 6 years to have it checked again. For blood glucose, the general guidance is starting at age 45, but this can change for you depending on your risk factors and other things that might be going on or family history might make your clinician check earlier. So if you have it checked early and it's normal, then the guidance is every 1 to 2 years. But if you have pre-diabetes or diabetes, then this guidance completely changes and your clinician tailors your monitoring depending on how well you're doing.
Okay, so we've touched on high blood pressure, we've touched on cholesterol, and we've touched on blood glucose. Weight is the next thing I want to make sure we bring up. It's a big topic these days. How does being overweight and obesity impact heart health?
So yes, another very important one. And I know I mentioned Life's Essential 8 earlier. So we've talked about the 3 things that your physician can help work with you to monitor and manage. But the other 5 things actually are things that are within our individual control. And one of them is weight. there is a lot of data that tells us that being overweight or being obese increases your risk for cardiovascular disease. And one way that you can reduce or manage that risk is by maintaining a healthy body weight as much as you can. Even a little bit of weight loss can significantly reduce your risk for heart disease. And we have ways that this is assessed. So if you go see your doctor, they measure your weight and your height and they calculate something called a BMI. And then with that number, they can kind of tell you whether you're within the normal weight, whether you're overweight, or whether you're obese. So things that we recommend for patients to do to lose weight or to try and get to that healthy weight are actually things that we recommend for managing your health in general. So things like eating a healthy diet, exercising, getting enough sleep, all of those things can actually help to improve your weight. And I know that we have some more discussions talking about what are the other options for weight loss. If you've tried it all, try to exercise, eat a diet, and I am still struggling. What else can I do? So I know we'll talk about that soon as well.
Yes, I actually think Anne may have a little bit of information for us. And we know that weight sometimes is not easy to manage and it can be difficult. You can face barriers when trying to lose weight. Are you able to tell us how to determine a healthy weight? And what would your tips be for weight management? How do you counsel veterans that you see on a daily basis?
So, identifying a healthy weight and the guidelines specifically for the VA, we would, the ideal will be 18.5 to 24.9 BMI. I'm just looking at the grid. There's specific numbers that we find to be, and the BMI, remind you, we understand it's not representative of, it's a number that we can use, but it doesn't necessarily mean how much fat you have on your body. It's just like a piece of the information that helps us with measurement and identifying some risk factors. If you a lot of the time, and we focus on in the past, we're focusing on the BMI, and we're trying to look at it in a multi-dimensional way about health overall, not just that number. But it is what, if we talk about, if there's a discussion about weight loss medication, it is the guidelines of VA goes by. So it is something to be considered in some surgeries and all that. If you have health goals and you are experiencing joint pain or barriers to even starting physical activities, some of the tips I give my veterans is, start off with physical therapy. It is, there we have programs now, and I'm going to include in the chat. The Department of Defense has an at-home physical therapy program if you can't make it to campus. But getting those muscles stronger to support those joints, but in a guided way, so you don't injure yourself worse. We also have like aquatic therapy that we can refer veterans to. So if your joints are in a lot of pain, you just need to get over the hump. There are ways to get you there. Not everybody's going to open up the door and start running right away, right? And so getting you to a point where you're not going to injure yourself and get demotivated from the weight loss is a big thing. And also looking at dietary, meeting with the nutritionist, like maybe just once or twice, being like, hey, this is what I eat. And a lot, that we have great resources within our team and the PAC teams where they can just look at your meal planning, give you some pointers. It doesn't have to be something that you meet with them multiple times and they're going to be picking apart your diet, but just get some guidance there. That might give you some tips about what things you didn't consider. But we also have the MOVE program, and I think most veterans have heard about it. There will be some links on that, but if you go on the va.gov resource web page and you just type in the MOVE program, they'll let you know what local activities to get up and move and start like kind of boosting that, boosting you up to start losing that weight, what's available in your local area. So va.gov, and then just type in the MOVE program. Great resources there.
Excellent. And Dr. Avery, GLP-1s have also entered the chat lately. Can you talk to us about what is a GLP-1 and how it can help with weight loss and how the VA
Yes,
participates in that?
of course. GLP-1s aid in weight management through multiple pathways in our body. These medications mimic a natural hormone that's called GLP-1, and it signals your brain that you're full and satisfied after eating, reducing your appetite. They also slow down how quickly food leaves your stomach, helping you feel full longer and aiding in regulating blood sugar and improving how your body uses insulin. They are not a cosmetic tool, they are a metabolic therapy. They do work best as a comprehensive approach that includes nutritional, physical activity, and lifestyle modifications, all bringing those pointers that Anne just talked about. GLP-1s are currently non-formulary in the VA, and veterans must meet specific criteria for approval. So we would like you to discuss with your healthcare team if you are a good candidate for GLP-1 therapy.
Thank you so much. Now, for all of our participants, going to the doctor and talking to your healthcare professional, sometimes that can make us a little anxious. I know that my mom always loves to take someone with her. You all are dealing with veterans every day, dealing with patients every day. What tips or guidance do you have for our audience when it comes time to go to the doctor and have those crucial conversations and just get them started on this journey of a healthy heart? I don't, it doesn't matter to me who starts, but I would love to get all of you to weigh in on that.
So I'm happy to jump in and get started. And I would say that I think that many physicians recognize how important it is for patients to take charge of their own health and to be involved in that decision making. Because when you go see your doctor, you get a lot from that conversation if you kind of prepared in advance, you ask questions, you make sure that you understand what's going on. And a lot of the things that your physician or your clinician is telling you during the visit, a lot of it relies on you to actually do it when you leave the office. So I always say that the large part of patient care actually is reliant on the patient. So if you're going in to see your clinician and now you've heard about like knowing your numbers, it's a good idea to ask your doctor if you're not sure whether you've had these numbers checked. Oh, I heard that, there are certain numbers that I should have to make sure that I'm at I'm achieving my ideal cardiovascular health metrics. And, when last did I have this done? Is it time for me to have one done? Those questions are very important. If you're measuring your blood pressure at home, then take a log of your blood pressure with you so you can discuss with your clinician, do these numbers look okay? Do I need to do something different to make sure that, I improve these numbers? And apart from all the key things we talked about, like blood pressure, blood glucose, and blood cholesterol, also the behavioral things that we talked about, like getting enough sleep, physical activity, eating a healthy diet are also important things to discuss with your clinician when you're going, for that visit. I know that I'm always willing to listen and hear about it. I know some of my patients would even use like new tools now to help them come up with questions because there's a lot of anxiety when going to the doctor, and that's okay. If that helps you come up with the questions or the important things to ask your doctor, you can do that ahead of time if it helps you feel more prepared when you're going to that visit.
Need that, Dr.
Yeah.
Avery?
I'd just like to add that open communication is key. Just make sure you ask questions, ask what you should be monitoring, really get involved and advocate for your health and how can you improve your heart health.
Right. And Anne?
Yeah, I just want to share a couple of things. One way, as I work in the women veterans clinic over here, Women's Health Clinic, and there are certain when you come into your appointment, we had a veteran who her blood pressure was just always so high when she came in, super high. And I'd always be ending up calling her and like being like, hey, your blood pressure is high. We need to do 2 weeks of your blood pressures. You know, she would always do it and always provide it, but her numbers are always good at home. And then she then advised, as we grew in our relationship as a nurse to patient, she did tell me that she struggled with military sexual trauma. There's some things that cause your blood pressure to go up, and for her it was, you know, the VA. And she's like, this is my barrier. So if, you know, developing those relationships, and hopefully you do have the opportunity where you can really feel comfortable with your healthcare team and sharing that things that, you know, are may not be right off the bat something that you would relate to the high blood pressure. Another thing is like, oh, I snore, sleep apnea. These are all little things. Sharing barriers in a healthy lifestyle, they kind of all interact with one another. So just being, it's not just about the number on the screen. It's looking at all of the things that could factor into that number and having those discussions, because it helps us look at you and not, you know, not just your numbers, but as an individual, so we can meet you where you're at.
I like that. So we've I think done a good job of giving the audience an overview of those key numbers that they need to make sure that they are aware of as we focus on heart health. If there is one thing that attendees can do today, if they don't know where to start, what would that one thing be for you, Dr. Adinde Shewa?
I'm sorry, it might not be one thing. So I'll just say again, it's the life's essential eight. I know we talked a lot about the three, so I'll summarize the other five behavioral things very quickly. So if you're smoking, stop smoking, big risk factor for heart disease. Maintaining a healthy weight, we've talked about. Getting enough sleep, I didn't provide you numbers earlier, but recommendation is 7 to less than 9 hours. If you can get that every night, very, very important for your cardiovascular health. Diet, we keep saying healthy diet, and people say, which one? The two diets that we talk about that can improve your cardiovascular health is DASH diet and Mediterranean diet. So you can look that up as well. And then for physical activity, we say getting at least 150 minutes of physical activity a week. And this should be at least moderate intensity or higher exercise. These are all the things that you need for your ideal cardiovascular health. So I'm sorry, it's not just one, but it's eight. Okay.
It was good information. And do you have one thing that you would tell attendees to focus on today if they don't know where to get started?
Identify what's important to you and what kind of identify what you want your life to look like, and then start using the tools, the resources available. We want to help and support you. So don't envision this moment, envision where you want to be, and let us help you get there.
Excellent. And Dr. Avery?
I'd just like to add, if you're not sure where to start today, begin by making just one small change. It can be something as simple as adding an extra serving of vegetables to your daily diet, going for a 10-minute walk, or scheduling a checkup with your healthcare provider to get a full detailed picture of your health. The small changes can lead to big impacts over time.
Thank you so much. So I think we've gone over quite a bit of information today. We have some final slides to share with you. Every VA clinic does have a women's health team, and we are here to support you. So we certainly encourage you to reach out to your closest VA and get in contact with your Women Veteran Program Manager. The VA is here to help. If you want, you can take a screen capture or a picture of the slide before you, where we've outlined some of the most valuable programs that the VA has to help us and help you manage your health, your weight, your heart health. These are all ways that you can get connected with great resources at the VA. So we'll pause there. I don't know. Ann, did you want to say anything specific on this slide other than to make sure that folks take a quick picture of that? We'll also post some resources directly into the chat, so you'll have access to those as well.
Yeah, and I will say that although the VA does not cover gym memberships, a lot of the VAs do have gyms, but there's a lot of places throughout the country that do support and give a discount to veterans. But there's other resources there, so get discouraged if it's not just typical gym. There's like lots of other stuff we can offer you, and talk to your nurse care manager and tell her like I said so, and that she can give you some information to help. Okay.
Excellent.
And I'd just like to add that you can ask anybody on your primary care team to place a consult to any of these programs.
Thank you, Dr. Avery. That's important. All of these things are accessible. And so we want to make sure that you know how to advocate for yourself if you are in need of any of these resources. The American Heart Association also has some wonderful resources for us. We've listed the GoRedForWomen.org website here. The Know Your Numbers infographic is also linked second. And then Life's Essential Aid, which you've heard Dr. Adinchewo discuss several times today. It's a great resource for you. Additionally, we're going to close out with this final slide to please encourage you to take action today. As we've stated, it is important to know your numbers. We want you to set a realistic health goal. You don't have to tackle everything at once. Just take that one step forward and become a lifesaver. Learn CPR. Although you may not be impacted by heart disease today, you could save the life of someone you know and love, or even a stranger. So reach out and figure out how you become a CPR certified through your local American Heart Association. And of course, sharing is caring. We're going to rebroadcast this Heart Smart Town Hall on February 26th at 7 p.m. Eastern on the American Heart Association's YouTube channel at American Heart. I want to thank my panelists for bringing such good information to us today. We appreciate your participation. And all of you who chimed in the chat and attended today, we certainly appreciate your active engagement. We do have a few minutes for some questions, so we'll go through and see if we can answer as many as we can. If you take one thing from today, let it be to make sure you schedule that appointment and have the conversation so that you too can know your numbers. We want you to be heart smart so that you can have heart health. So let's get into some of those questions before we log off.
Oh yeah, there were a couple of things that Caroline flagged for us, and it looks like a couple might be popping in. Rosa asked if we would repeat the names of the diets, and that's the DASH diet and the Mediterranean diet, right?
That is
What
correct.
else? I think Nanette asked if every VA clinic has a women's health team. That might have been answered. I think I heard that answered. That was a yes, right? Okay.
Yes.
There were also some questions around monitoring while it was being discussed, like glucose and blood pressure. And Anne had shared that the VA has a video as well as the AHA infographic that I think is going to be shared post call. Is that right, Latoya? A
That
video.
is correct. We'll share that with everyone here. If we are able to drop that resources document into the chat, we can certainly do that as well. I
Okay.
did see one of those
Oh,
monitoring questions ask how you monitor blood sugar at home. Dr. Avery, did you want to share?
Yes, the VA will provide a glucose monitor and all the testing supplies for newly diagnosed diabetic patients. And that is one of those poke your fingers that you just use a blood drop and it reads your blood sugar levels.
Okay, great. Thank you. What else do you have for us, Heather?
Well, she's looking. I was just going to add with regard to blood pressure devices, if someone wants to get one, they can also share resources with you. We prefer that you use a validated cuff, and there's a website that you can look to see which cuffs are validated. Depending, I know sometimes this might be covered by health insurance. I'm not sure if the VA provides one. If you do meet qualifications, you might be able to get this through your health insurance, but sometimes people want to purchase one for home use, and that's fine. But just making sure you check out that website, validatebp.org, and getting a validated device to make sure that you're getting accurate blood pressure numbers at home.
I think this
Yeah,
question.
and just one thing for as far as the blood pressure cuffs, we also, if you need a wrist cuff, that's available, and the VA covers the wrist cuffs if you can't get one that actually fits your arm, available through prosthetics. And they also, it's a very quick ask, and they'll mail you out a home blood pressure cuff. And if you ever just want to check your blood pressure cuff at home, you can always bring it in with you to your primary care appointment and just have them tested against one of our machines that have been QC'd.
Excellent. Dr. Adedinshewo, there was a question that asked about symptoms of mild diastolic dysfunction, if there were any telltale signs of it getting worse.
So that's a good question. I think I saw that flash through as well. So diastolic dysfunction is a little bit of a tricky one to discuss because by itself is not considered an issue, but it's something that is associated with other conditions. So something, that may be referred to as diastolic heart failure. So if that's what, the question is, then the common symptoms that you would see with that is things like shortness of breath, either occurring at rest or with minimal activity. Some patients may also report low extremity swelling. But if this is something that you found on a report or a test that you got, depending, it's unique to each patient. You might not necessarily have symptoms from this. So I always say the best thing is discuss with your clinician if this is something you saw in a result to know how does this impact you and how is this relevant to your health.
Excellent. And the other question that I saw around that time was someone asking how high is too high for that top number. She takes medications and sometimes her number goes above 130.
Okay, so yes, if it's above 130, then yes, that's in the hypertensive range, and this is hypertension. But we start to worry that this could potentially be associated with an emergency or, an urgent clinical intervention is going to be needed when that top number reaches 180. So you don't want to get to that point. Also, if you're pregnant or recently were pregnant, then the number that we worry about actually is 160. So that also differs. So if you notice that your blood pressure is remaining persistently high, it is better to reach out to your doctor to discuss this. You don't want to wait till you get to that urgent or emergent number to do something about it.
Okay. And is there an association between NAFLD and heart disease?
So yes, so that has to do with fatty liver disease. And I would say it's a little bit of a complicated topic to quickly talk about in 10 seconds, but this is something you need to have a conversation with your clinician about. So yes, there is some relationship, but unique to each individual patient.
Excellent. I think that's all the questions that we have time to address today. Again, thank you, panelists, for being with us. And thank you to our audience for such engagement, discussion, and great questions. We hope that you have learned at least one new something today. All right, we'll sign off here. Take care. Enjoy the rest of American Heart Month. Bye-bye.